Hello, everyone. So, today we're going to be presenting maternal health among Black women. And I'm Mariah, and in our group we have Natalie, Judith, Megan, and Emily. So, today we're going to be talking about the problem justification, the program background, our logic model, our evaluation plan, and as well as some future considerations. So, to begin with, our problem justification. Black women are 4 times more likely to die due to complications related to pregnancy compared to white women. And for the most part, pregnancy-related deaths are preventable, and according to Lewis, Menard, and G in 2015, they reported that the 5 leading causes of pregnancy-related deaths are preeclampsia, hemorrhage, infection, venous thromboembolism, and cardiomyopathy. Black women are also more likely to receive late prenatal care, and oftentimes they do not have full insurance coverage. And that is because the MPFW reports that 75% of Black women get maternal care from predominantly Black serving hospitals. And in these hospitals, they're known for providing low quality care due to the lack of resources, which results in severe complications. And the racism that Black women face both within and outside of the healthcare system are acute or chronic stressors that may actually result in these physiologic consequences that affect reproductive outcomes for them. And out of 15 childbirths, 12 are poorly delivered compared to white women. And the poor maternal care these Black women receive stems from the high rate of unintended pregnancies. And this existent disparity of not having access to family planning or contraception allows the system to fail Black women from the start, which is why we believe that this is truly a problem that needs to be addressed and is addressed throughout our entire program.
Our planning team is aware of the health disparities faced among Black women when it comes to maternal health. These health disparities include Black women not getting the medical care they need, Black women feeling as though they are not taken seriously in medical settings and have concerns about their health, and Black women face pre- and postpartum depression that needs to be addressed in order to keep them under control so they can properly function and take care of themselves and their babies. Therefore, our planning team decided to create workshops that will give them the help and support they feel they are lacking. Our overall health initiative is to hold workshops to participating Black women that will provide the proper knowledge of screenings, depression, and common pregnancy complications. Surveys will first be given out to participating Black women. These surveys will evaluate the need and problem areas in which our team can best accommodate for. Activities included throughout the workshops will provide these women with support for preventing common complications and give them the proper coping strategies for pre- and postpartum depression. It is through our health initiative that the planning team wants to evaluate whether or not the workshops improve the knowledge and maternal health of Black women. Our program's mission statement is to increase maternal health knowledge in Black women to ensure competent and adequate pre- and postnatal care. As a planning team, we constructed 3 goals, which is 1, to increase maternal health knowledge among Black women, increase the knowledge of pre- and postpartum depression in Black women, and increase Black women's knowledge of the maternal health resources that are available. Moving on, the 3 main objectives of the program are 1. Black women will be able to identify the signs and symptoms of common complications that may arise before, during, or after pregnancy. 2. Black women will be able to name 3 different resources where they can receive maternal health care. And 3. Black women will be able to identify at least 3 reasons why screenings are necessary and important for their maternal health. These objectives will help the planning team track the progress of the program.
Here is a close-up of our logic model. We plan to have a series of maternal health workshops for Black women. Therefore, we will need trained staff for the workshops as well as volunteer interns who will receive no pay, which will allow us to focus more of the budget into the program. We will also be needing technology and a facility for the workshops, which are planned to be in person. The workshops will be our activities, and each will focus on different topics to ensure that mothers are supported before, during, and after pregnancy. Topics will include depression, pre-screenings, and common complications, among others things that Black mothers tend to experience. Resources will also be available for participants. We will have 5 sessions, and the hope is that the program will have a high retention rate. Our short term goal is for women to learn about how to have a healthy pregnancy, learn about the proper screenings, and also understand common issues that arise during and after pregnancy. For our midterm goal, we hope that women will have a better understanding of maternal health and know the recommendations on what to do to have the healthiest pregnancy possible, as well as what resources are there to help. Our long term goal is to improve the maternal health of Black women. For our logic model, we also have some assumptions. So we are assuming that the content of the workshops will be presented in a manner that is interesting to participants and that they will want to continue coming to these workshops. We are also assuming that our staff will be culturally competent to present the material to our target population and that our target population will know about the program and take advantage of the resources that are offered. We also have some contextual factors that need to be considered, such as the social economic hardships that may impede women from attending the program, whether the location of the workshops is accessible, and if the program will receive proper funding to be successful.
So, for our evaluation plan for formative evaluation, the evaluation question we asked was if workshops need to be modified to increase participants' awareness and knowledge of their maternal health. The evaluation design was a qualitative evaluation designed to assess the program. The participants being evaluated are the participants who attended the workshops. For data collection, we will have focus group discussions with participants to see if their knowledge about how to have a healthy pregnancy has improved. For evaluation timing, surveys will be given to participants at every workshop to see if their awareness and knowledge has improved. The evaluation question we asked for process evaluation was if there were any problems in the delivery of our interventions for our program. The evaluation design was a qualitative process evaluation of a collaborative quality improvement for maternal health. The resources of the program, like the information given out on workshops and the staff who are teaching those workshops, will be evaluated. For data collection, interviews will be conducted with staff to ensure that they are providing participants with the proper information. For evaluation timing, staff interviews will be given after each program intervention. The evaluation question we asked for impact evaluation was if the program workshops accurately address the needs and interests of their participants. The evaluation design was a mixed non-experimental and quasi-experimental design. The participants in the workshop will be evaluated to determine the impact of the program on maternal health outcomes. For data collection, pre- and post-tests will be given to determine if the study accurately addresses the wants and interests of the women to retain participation in the program. A statistical analysis of the participants' maternal health outcomes would be performed in comparison to Black women who did not participate in the program. For evaluation timing, the survey would be given as a pre-post test before the series of workshops and at the end of the workshop series. The overall impact evaluation would be performed at the end of the women's pregnancies. The evaluation question we asked for outcome evaluation was if participants' knowledge of maternal health was increased by attending the workshop series. The evaluation design was a quasi-experimental pre-post test design. The participants who attended the workshop series would be evaluated to measure the knowledge gained. For data collection, pre- and post tests would be given at each workshop. Participants would fill out the test when they get there. Then at the end, they would complete the post test, and the results from the pre- and post test would show whether there was an increase in knowledge for that particular topic. For evaluation timing, pre- and post tests would be distributed and collected at every session.
Now that this program has been implemented and evaluated within a small local group of women, it's important to start considering where this program can go in the future. One of the biggest questions to consider is whether or not the program should be expanded to other communities. In our discussion of this question, we decided this program would benefit from expanding to other communities, as Black maternal health and mortality is an issue that exists across the entire country. If the program is expanded, there are a few important aspects of our program we would need to ensure stays the same. This includes keeping our workshop sizes small, making sure the women feel heard, and keeping a sense of community between the participants and the program team. Something very central to the program is making sure women feel heard and fully supported during their pregnancy. And large class sizes may make the women feel forgotten about and unimportant. To prevent this from happening, the workshop sizes should be kept small, and enough program staff members should be hired to ensure that all those who are enrolled are fully supported. Another important question that will need to be considered is whether or not there's a need to expand the services of our program. From our discussion of this question, we decided that the program should stay mostly focused on its original goal of educating women on maternal health topics. This being said, we would still recommend the program considers partnering with local hospitals and doctors' offices to provide better health services for the women. This would also allow the program team to focus on their goal of educating women, while the doctors could focus on the actual physical health. By partnering with local doctors, the program staff would also be able to voice the women's biggest concerns to the doctors and advocate for their rights as patients. From this project, we learned how to properly design an intervention that was culturally tailored toward our target population. We also learned the different measures that could be used in accordance to our logic model and how to design a logic model that includes all the necessary inputs for the intervention to meet its goals. We were also able to better understand how to evaluate an intervention and how to properly apply the different evaluation and data collection techniques. Most importantly, we learned just how much work and consideration goes into planning a proper intervention program. Something that we could have done better in this project would be to add a component that would evaluate overall cultural competence of the intervention. Since our overarching goal is to improve maternal health outcomes among Black women, it would be important to understand whether the intervention was deemed culturally relevant and appropriate for the target audience. Overall, this project was very beneficial to our learning. We were able to apply what we learned in class to a real-world example that will help us in our future careers. Because of this assignment, we now feel we have the skills needed to design and evaluate intervention programs in the future. Finally, here is a quick look at all of our references. Thank you all for watching.